The fear of vitamin D deficiency should be greater than the fear of vitamin D toxicity. I like to describe vitamin D deficiency as a cesspool of toxicity because there's so many things, bad things that happen when you're deficient. Well, at the Drake Center, it wasn't a long term, they called it a long-term acute care hospital, but the average length of stay was about 24 days. Okay. The hospital I work now, at Summit Behavioral Healthcare, it's a state psychiatric hospital, and over half the patients are there for over a year. Mm-hmm. Some of them have been there for 20 years. They're not supposed to live here, but some of them stay there for a long period of time. So I've been able to watch people for years since I went there in 2011. So I have a lot of long-term data on the safety of 10,000 units a day. It is completely safe. You know, the highest 25-hydroxyvitamin D level I've ever seen is 230 nanograms per ml, and somebody had been on it for several years. But I have been keeping record of these lab values in notebooks since the day I got there. Calciums, vitamin Ds, PTHs, and any other abnormal lab. I can just show you all these things in this data. And that's what I used to put together the paper I published in 2019, which I call the 7-year experience. Insights from a 7-year experience of treating patients with long-term patients with between 5,000 to 50,000 units of vitamin D a day. Heaney's study, it took about 3 weeks for people to get up to the lower end of normal. He was giving them 5,000, 10,000 units a day. Well, I wanted to get them there like tomorrow, you know, so I started putting them on 40,000 units a day for a week or two, and then I cut them back when they get to lower end of normal. So I'm checking it twice a week, right? When I got to lower end of normal, I just cut back to 10,000 and left them there and just kept watching. I was not going to cause harm. I was checking labs twice a week. I was checking, you know, complete metabolic profiles, vitamin Ds, and I've been monitoring intact PTH hormone levels now for several years. You know, one of the articles that the safety of vitamin D, there's a huge band of safety. You know, it's one of the articles that I had sent to you to talk about was this toxicity report published in, I think it was 2011. First author was Iraqi, and McCullough was one of the authors. Because I did a lot of searching for toxicity reports, and over time, you know, the estimates for how high 25-hydroxyvitamin D level needed to get before you started getting adverse effects went from 150 to 240 to 300. Glenville Jones, one of the members of the Institute of Medicine's committee that came out with his recommendations, published in 2008 an estimate that you get up to 300 nanograms per ml before you had any issues. 2008, 3 years later, he drops it down to 50. Was it 50? Yeah, they didn't want you to get about 50 nanograms per ml. I don't know how he went from 300 to 50. But in this report from Iraqi in 2011, it was 2 case reports, and one person took 1.8 million units a day every day for 2 months because of labeling and manufacturing errors. Another one took over 900,000 units every day for 1 month, and they both got sick, but neither one of them died. Both of them recovered uneventfully. One of them needed a lot of care, some IV fluids, went in the hospital for a while, IV permeginate, bring down the calcium level, but over time, they stopped the vitamin D and asked, is it wore off because it gets metabolized? You know, it's being used all the time. Every cell in the body needs it, and when it gets metabolized, it becomes inactive, and you have to have more coming in to keep everything going, right? So eventually, the half-life's been estimated to be, you know, 2 to 3 weeks. When the 25-hydroxyvitamin D level got below 400 nanograms per ml in each of those patients, the hypercalcemia resolved and their symptoms abated. It took a while for the 25-hydroxyvitamin D to get down to a lower level, but you know, one of them peaked at over 1,200 nanograms per ml. The other one was over 600 nanograms per ml, 25-hydroxyvitamin D, and they recovered uneventfully. Mm-hmm. I've been taking 50,000 units a day for years, somewhere between 40, 50, 60. You know, it helped a skin cancer on my hand get better. When I went from 20 to 40 to 50 to 60, then I cut back to 50, and I've been staying. My average 25-hydroxyvitamin D level is in the 200s. The calciums are always normal. The intact parathyroid hormone levels are always measurable. In the Iraqi study, the intact parathyroid hormone level became undetectable for a period of time when they were really super high with their 25-hydroxypyridine, but then it came back once the levels came down. So that's why I always check PTH levels. And in my experience treating long-term hospitalized patients now, my protocol is 10,000 units a day. I get them on that, leave them on that, and we monitor calciums and PTHs. Calciums are always normal, PTHs are always detectable. There's never any issues with renal function. There's never any issues with kidney stone formation. Nothing bad happens. Only good things happen.